Hi, everybody. Welcome to another session of Stay Connected. This time featuring me, Mike Hirsch, your medical director for the Division of Public Health for the City of Worcester. And here we are in the dog days of August. The summer has progressed. It's been pretty hot, unfortunately very dry. We have some major drought conditions all through the Commonwealth. And we're still not done with the COVID virus. So I want to touch base on a number of these things. But just in general, if these hot and dry days continue into August, which they're likely to do, it's very important that if you're a senior, you realize that your skin has over time become a little bit thinned out. So your likelihood of losing water volume in your tissues from sweat and also from the notion that when you're very hot, you have a tendency to open your mouth and breathe through your mouth, and that ends up being a way of losing a lot of moisture. So hydration, meaning drinking a lot of fluids, is very important as you move forward through the rest of this summer. And it may go well into September that our climate is much warmer than it used to be. And they're just extremes. Like when they show that thunder showers are coming, it's not just a thunder shower, it's an absolute deluge, and everybody is worried about flash flooding. Flash flooding in the face of this terrible drought, because when the ground is that dry, it doesn't always absorb the water. Instead, it runs off and can cause creeks, and the common ones that you know about in your neighborhood might tend to overflow. But you should always have in your purse, in your car, in your bus drive, when you're going over to the senior center, a bottle of water handy so that you can keep yourself hydrated. The city is going to be standing up hydration stations and cooling stations all through the summer when we get one of these official heat waves, which is 3 days of 90 or above temperatures. And I think that you have to take advantage of that. If you're out and you're feeling kind of woozy, and get yourself sitting down, get yourself a drink of water or any beverage, but water is probably the best. And don't overdo it. Don't go out in the midday sun. Try to go out, earlier in the morning or later at night. It stays light out, till 8, 9 o'clock. So you can get some stuff done in the later afternoon, even into the evening. So that's something we experience almost every August, but unfortunately with the way that the climate is changing, I think we're going to see more and more extremes of weather. And I hope that the powers that be in Washington can come up with some kind of a compromise that will help us stem the tide of this global warming phenomenon, or at least admit that it is a problem, because that's the first step, right? So as far as the other things we've talked about in past issues, when there are drought conditions, that's actually not so bad as far as mosquitoes go, because they don't find the pools of water to breed in as easily as when there's a lot of water around from rain. But it's still very important to remember your 5 Ds, right? Dawn and dusk, don't tempt the mosquito. That's the time that they want to bite you. Dressing appropriately with long sleeve shirts and long pants. Using DEET, which is the magic insect repellent that is very effective against most mosquito bites. Thus far, we've only had one reported case of West Nile virus in the Commonwealth, and it was in Bristol County in Plymouth. And I think, again, that's a reflection of the drought conditions because they're not finding enough stagnant water to breed in. And that's the last D, is if you have on your property old tires, culverts that are clogged up, that cause puddles and pools, that's where the mosquitoes like to breed. And pay attention to the WorcesterMA.gov site because we flash the announcements about the spraying program that we are doing for mosquitoes. The mosquitoes are constantly being sampled. You may see these black traps hanging from trees in your neighborhood. And if they sample them and find either West Nile virus or triple E, they target those neighborhoods. They make the announcement well in advance. This isn't an aerial spraying job. This is a truck that goes around and sprays. You can see online how to opt out if you don't want your property to be sprayed. But if you're close to other properties, you're probably still going to need to know when they're coming around so you keep your loved ones or your pets indoors for the hour or two after they've come around to spray. But let's get down to brass tacks about the pandemic because we were very optimistic that the numbers were going to go down after July 4th weekend. And we didn't see a big uptick after July 4th weekend. But now we are seeing an uptick, and that's because a new variant is in town. We were dealing with the BA2.12 variant. Now we're dealing with the BA5, which I think I mentioned last time we spoke was brewing in upper New York State. Well, it started to spread, and it's very, very transmissible, more transmissible than any of the variants we've seen before. It doesn't seem to pack the same amount of punch in terms of making you sick. Now, some of that is because many of us have gotten our vaccinations and our immunity prevents us from getting super sick. Some of us had previous COVID infections. That gives you a certain amount of immunity too. And if you've had both vaccinations and a previous infection, you have a lot of immunity. But this variant is dangerous because it really is so different in its configuration that it partially avoids the vaccination immunity that we were hoping to give everybody, and is kind of the canary in the coal mine that moving forward, our scientists are going to have to guess what kind of variant is going to come down the pike moving forward. And they'll have to adjust the boosters to COVID virus moving forward. And that's, I think, what's going to be happening sometime in the fall. There'll be a call for another booster. So if you've followed the regimen that has been recommended by the CDC and the Mass Department of Public Health, you should have gotten 2 doses if you've gotten Moderna or Pfizer, and then a first booster and then a second booster of both of those. If you've gotten Johnson & Johnson, you got 1 shot initially, and then the recommendation was to get a booster after that. And the recommendation was actually to try to get either a Moderna or a Pfizer booster to give a different look to how your immune response was going to go. I think that come the fall, we're going to see a recommendation to take a different kind of booster, and it may be mixed with flu vaccine. You can probably get it separate, but that's one of the hopes, is that we could get bigger bang for the buck if we did both together. What's different about this BA5 variant is it's not causing tons and tons of pneumonia. Most of the people that are getting this they get headaches, they get fevers, they get cough and hoarseness and sore throat. That's usually how it starts. And as I said, fortunately, it doesn't make people very sick. But if it's going to the point where you're feeling sick with this virus after you've taken your test to show that you've had it, we have this oral medication called Paxlovid, and we also have still the monoclonal antibodies that you can get to keep you from getting sick enough to go to the hospital. So you have to just kind of be very, very aware of your symptoms. Don't write off symptoms of like a summer cold to just it being allergies or some of the usual summer colds that you've had. You may have COVID. And if you do, it's best to know about it, treat it if you need the extra treatment, but at least keep yourself away from might have immune compromise, lung disease, heart disease, diabetes, or young children around who haven't been vaccinated. And there again, I want to appeal to you. Many of you are grandparents. Some are great-grandparents. They came out with the FDA approval for our youngest 6-month to 5-year-old population to get a vaccination from either Pfizer or Moderna. It involves 3 shots, unfortunately, much smaller doses than the older children or adolescents are getting. And only 18% of the country's children in that age group have taken advantage of that. So why is that? Is it because the parents are scared that this is a new vaccination form and they're not sure what it'll do to their children? Is it because people are just feeling like, what the heck, let's just get COVID and get it over with, and then I have some immunity and I don't have to worry about it again? Are they distrustful of the recommendations of the CDC and the public health agencies? The answer is probably a little bit of all of those reasons. But we're really, really trying to work hard with family medicine physicians and pediatricians who really are the trusted primary care doctors for youngsters to get those vaccines available in the office so that it doesn't stick out like a sore thumb, like you have to go to a special place to get the vaccination. We do have vaccine clinics going on to give those young people vaccine. But it's much, much better if you go in for your primary care visits with your child to have the pediatrician or the family doc give the vaccinations there like they do the other 16 required vaccinations that kids have to get in order to attend public schools. So it's a real stumbling block for us how to get more people vaccinated. Worcester currently is still in the mid 60% number for totally vaccinated. It's 64% as of the end of July. And that's frustrating because we made so many efforts to get people vaccinated, and I think it kind of has plateaued, and we're not seeing another bump now that these newer variants are coming in. So we've still got some work to do. I don't think we're done with the variants. I think new variants will still be able to thrive so long as there's a population of young people or old people that haven't gotten vaccinated or haven't kept up with their immunity by getting the boosters appropriately. So that gives the virus a chance to reproduce, and one of those reproduction cycles, it will produce a form of itself that's a mutant. It's different, and it may have more transmissibility. It may have more of a viral punch. It may have just a way of eluding the vaccinations that we've all been pushing. So the best thing you can do is get your vaccines, get them up to date, make sure you're boosterized as you should be. Try to get this population of kids, the 6 month to 5 year and the 5 year to 11 year, which has a 33% vaccination rate, get those populations vaccinated, and there'll be less of a likelihood that new mutants will come. And the other thing is being sensible about your masks. Remember masks? Well, everybody's sick of them, right? I'm not wearing one right now. I keep one in my pocket all the time. And when I go indoors, especially if it's a crowded indoor place, like a supermarket, a restaurant, some kind of educational facility with a lot of students, I put them on. And I would advise you to do the same. And again, the old surgical masks that we have that go with the ear loops, the cloth masks, the gaiters that people wear around their neck and go over their nose are not efficient against this BA.5 variant for sure. You need an N95 or a KN95 in order to beat these off. And even in outdoor venues, if you're outside, like sitting in a concert and it's very tight quarters and people are up on their, feet, cheering, screaming, maybe you're at a Woo Sox game, not a bad idea to have this on. Look, I'm 68 years old. I'm a high-risk person. I have diabetes. I have prostate cancer. I got a lot of bad things going against me. I'm trying to be as careful as I can because I want to be around. I don't know, and I can't predict who gets COVID will get really sick. But every once in a while, somebody still gets really sick. And I don't want to be that guy. And neither should you want to be. So that's all I'm going to say about COVID this month, because you've heard me like a broken record talk about this. But I think that now what we're learning is it's important for us to take personal responsibility. We're not going to have mandates. We're not going to have lockdowns. We're going to ask people to look at themselves as potential carriers of the virus, as potential victims of the virus, and do their best to figure out when and where to distance, to wear their mask, and of course, if there are vaccine issues where they haven't been vaccinated or they haven't kept up with their vaccinations, it's on the individual to fix that, because your individual health choices will greatly improve the public health of Worcester. And I think Worcester, again, has had an amazing track record at being compliant to a lot of the public health recommendations. But you're probably noticing that the COVID virus isn't even on the first or second or third item on the news now. It's kind of old news. It's back of the pages. And people are much more interested in Ukraine, gun violence, the January 6th committee, all of these things, very important. But you're not really getting the same kind of urgency about do this, do this, do this, because you're probably not listening to that. And we in the public health area are really, really tired of playing the same record all the time. Now, in June, when Holy Cross graduated, they renamed their science center after Dr. Fauci. And he came to Worcester and was so happy to be back. He was a graduate of the class of '62. He was a point guard for their basketball team, following the footsteps of our immortal Bob Cousy. And Bob Cousy was there to interact with Dr. Fauci when he was here. And what happened when he left here? He got COVID. After so many months of avoiding it and so much exposure, he got COVID right here in Worcester. He's back in action, but it took about 6 weeks for him to get to feel up to, his very rigorous schedule of public appearances and appearances on TV and other media. And he was very honest in his first couple of interviews when he came back, is that everyone has COVID fatigue. So I would just say we have to deal with this. We're grown-ups. We need to do what's best for the community by keeping these outbreaks at a lower level. But this is what life is going to be. The variants are going to come. We're going to see an uptick. Hopefully the Department of Public Health will be your early warning signal, and then you can react appropriately. You can take the advice or not. But if it's not, you may suffer the consequences, and I don't wish that on any of you. I just want you to be as healthy and safe as you can be. Which brings us to the other pandemic. It's not a pandemic. It's not even an endemic. It's an outbreak called monkeypox. And I think we talked about it a little bit last month. Monkeypox has made a blip in our radar screen. There have been somewhere in the range of 1,800 cases in the United States now. It's not a huge number, but certainly it needs to be mitigated. It needs to be watched very carefully so it doesn't go much higher numbers. The reason I think it won't go as high a number as COVID is that it is spread by touch onto infected surfaces and infected skin, and sometimes infected laundry. The virus in monkeypox is very much like smallpox, and it causes the skin to break out in a rash that initially is little red spots and then turns into what we call little pustules, meaning they have a white cap on them like they're filled with pus, like you had a pimple when you were a teenager. When these pustules break, that fluid, if it goes on a surface, if it goes on the person's clothing, or if it goes on your hands, you can get monkeypox. It takes about 21 days to incubate, so it doesn't present the same way like COVID does, because COVID now has an incubation period, the BA.5 variant, of probably only about 72 hours. So where we are seeing the most spread of this is in the population of men who have sex with men. It's not normally known as being sexually transmitted, but there's so much skin contact that if one person has it and the other person doesn't, that's how it's spreading. So we're trying to set the alarms out in the gay male community that this is something they have to watch. They have to make sure their partner does not have any of these skin things going on. And they have to also, if they are exposed to someone that turns out to have monkeypox, that they report to a center that can give them a vaccination. There are vaccines available for monkeypox. Here in Worcester, both UMass Memorial Medical Center and AIDS Project Worcester has access to these vaccinations, and the information about the vaccinations are, once again, on the www.worcesterma.gov site. So this is not something that the general public is going to find spreads like wildfire. It's a very specific subsection of our population, but because a lot of contact is happening in that population, it can spread. What you get with monkeypox, besides those skin lesions, are fevers, headaches, and sometimes some gastrointestinal upset. So you're feeling nauseous, it's very much like viral illness does. All the organ systems are off a little bit. There are severe cases where you can get infection in the lining around the brain called encephalitis, and those are mostly reserved for people with immune problems to begin with. So if you have lupus or HIV/AIDS or are on chemotherapy for cancer or immune therapy for cancer, you have a higher risk of getting an extreme case of monkeypox. Thus far, we've only had one identified case in Worcester and 2 contacts to that person. And our Department of Public Health is working very hard. Our public health nurses keep in touch with those contacts and track them down and recommend isolation and all of the mitigations that we can do. And the public has been very cooperative, the folks that have been exposed, in trying to minimize spread. But it makes a lot of headlines. I think it's like everything else on television right now. It's all presented with a very kind of loud, hysterical tone to it, and I can't go there when I'm talking to you. I'm very calm about monkeypox because I don't think it's going to be a general population outbreak. Is it going to cause more problems than Ebola? Yes, because more people are going to get it. Is it going to cause as much problems as BA.5 variant of coronavirus? No. So just keep your eye out for the kind of hysterical news reports with the big chyrons, on the bottom, those strips of writing, monkeypox everywhere, monkeypox, exponentially increasing in number. No, that's not happening. And I don't think it will happen. But it makes good press, What's that famous news jingle? If it bleeds, it leads. Like anything that involves death, dying, shooting, stabbing, bad illness, that's going to be the lead story of the night. So I don't think that should impair you from having a good summer. But it's very important that you realize how hot it can be in August. And I think going back to what I started off saying, make sure you're hydrated and make sure you have a bottle of water with you or someplace where you can cool off if you don't have air conditioning in your home and decide you just feel very, very hot. Reach out to your neighbors. Maybe they have an air conditioner and you can sit with them for just a few hours. And look out for your neighbors. If you know you have an elderly person next door to you who normally comes out in the morning, you see them either puttering in their garden or they're sitting out on their front stoop and you don't see them one day, don't write that off. Go knock on the door and say, is everything okay? And maybe offer to make a shopping run for them so that they don't have to go out in the blazing heat if it's really hot. These are the things that I think distinguish Worcester from other cities. There are a lot of good Samaritans out there, good neighbors that will look out for one another. And, when we were doing our press conferences with City Manager Augustus and Mayor Petty, we would point out these heroes every day at the conferences, and it was hard to pick because there were so many candidates. Now that there's no more of these daily press conferences, I'm just telling you, I am so proud of our community for just weathering the storm. And when you go, if you get a chance to the Woo Sox games or the Worcester Braveheart games, and you just see how happy people are to be together again and to be out and about, it really warms my heart that Worcester has earned that. So I don't want to take a step backwards over this BA.5 stuff or monkeypox. Think that we're going to do just fine if everybody just keeps calm, listens to the recommendations of the Department of Public Health and the Mass Department of Public Health, you're all going to have a very good end of the summer. So I'm going to quit there and just tell you that your listenership is greatly appreciated by me. I get very nice emails and also messages from the Senior Center that you're watching, and I appreciate that. And I'll never stop talking to you. If they give me the mic, I will be back again to talk to you about life in September and the early fall. So have a good August. Talk to you soon.